and of course bring you closer to God. And in this fasting season, please take time and fast. It's not only spiritually recommended, but also nutritionally. Sometimes you let the body use what is there at least 8 hours a day. At least fast core. We want to thank you for those who are fasting and encourage you to do more and more as we intend to promote healthier lives. I want to welcome Professor Robert Kalyesubula. He's an expert for physiology, he's an expert for the kidney, he's an expert in different aspects in kidney transplants. Oh my goodness, he's an expert in all those fields of study, and he's here with us. He wants to discuss with us an important issue about chronic kidney disease. What's the difference between kidney disease, kidney failure, kidney stones, and when does a transplant come? And all that much more. And of course, the mushrooming social media, especially kidney detoxes, kidney what. Everyone talks about these herbal teas, the herbal juices that can actually treat kidneys. Are they actually treating kidneys, or are they actually endangering them? And so much more. And of course, now, Professor, most welcome. Can introduce yourself, and let's ride on the viewers to learn more about this topic.
Thank you very much, Mr. Kamara, for hosting me. It's indeed a great pleasure for me to be here today and to talk about a topic that is dear to my heart, which is actually chronic kidney disease. As you've said, and I was here before sometime maybe last year to talk about chronic kidney disease. So kidney disease can be divided in several ways, but the easiest now we do is acute kidney injury and chronic kidney disease. So the kidney has several functions in the body. The one which is known by everyone is that the kidney is important in making urine. Everyone knows that. So when the kidney is not making good urine, someone might have a kidney problem. And that might be acute, meaning that it has not taken long, or it might be chronic, meaning that this abnormality has been there for more than 3 months. So we say someone has chronic kidney disease. There are certain measures we take. You can't look at someone and say, oh, that one has chronic kidney disease. We do tests. There are 2 major tests. One of them is based on the blood. We take a small molecule called creatinine. When we eat food, when we do our activities, after all these are done, the body breaks down some of the muscles into a molecule called creatinine. Creatinine is controlled in a very small range. Once it goes above a certain limit, and we calculate how well the kidney is working, the so-called glomerular filtration rate. If your kidney works at less than 60%, then we say you have chronic kidney disease. The other measure we use is the urine. The kidney, after it has done its work, the kidney is a very nice organ. It filters about 108 liters of blood per day. In order for it to give you about 1 liter to 1.5 liters of urine which you pass per day, it has filtered about 180 liters of blood going to and fro, going to and fro. So that filtrate in the urine should be clear of any abnormal substances, things like protein. So when we find protein in urine, or even a smaller molecule called albumin, when those molecules are found in urine, then the kidney is not holding on to them. It is filtering them out wrongly. The sieve is not working. So when you combine a reduction in kidney function and a leakage of protein in urine, this persists for more than 3 months, that's what we call chronic kidney disease.
Wow. I like the description now about chronic kidney disease. So what is now kidney stones?
So kidney stones are like the usual stones. They are small stones. Of course, they are small in the kidney, but these form when we have molecules combining. Normally, when the kidney is working, it has a good flow. Urine passes there, and every substance is taken out. But in certain people, either because they are not drinking enough, largely because they are not taking enough water, some of these substances which come from food digestion remain in the tubes that transport the urine, or even in the kidney itself as it is forming the urine. So once they collect at a certain, they begin like a small dot. Then if you don't pass that dot out by drinking enough water, other dots come and attach to it, and then it eventually forms a bigger dot, which is called now a kidney stone, depending on the size. These kidney stones are usually made of substances which normally are worked on in our body. The bigger molecule is actually the calcium, and then the other one is the oxalate. So once you have calcium oxalate combining, you get what are called calcium oxalate stones. Sometimes the calcium combines with the phosphorus, and you get what is called calcium phosphate stones. But other times you also just get an abnormality of production of what is called uric acid, which is normally broken down by enzymes in our body. So sometimes when you accumulate a lot of that, especially in people who have joint problems called gout, they can form uric acid stones. Others, because they have chronic urinary tract infections, they can also form stones because the bacteria come and form those dots, and they become bigger, and they attach on the walls of the tubes of the kidney called the nephrons. And once they attach there, they form what is called Stackhorn stones. Now, the stone is ideally supposed to be passed through the urine and you pass it out. But when it gets bigger, then it can get stuck along the pathway of the urine. And when it does that, it causes a lot of pain. And so kidney stones can actually form by us not taking enough water. They can form from the diet we take. And this is largely taking chocolate, taking a lot of red meat, sometimes even too much coffee. But those are the common stones that are actually formed. And they can be very, very painful, especially when they block that tube where the urine passes. When we are still in school, they used to say that the pain from a kidney stone is like a normal delivery of a child. The pain the women go through is the same pain that kidney stone can cause. And of course, depending on the size of the kidney stones, sometimes you are able to treat them by giving you drugs that can dissolve them. But when they are very big, they have to be broken down through a process called lithotripsy. They give electric shocks, and they melt them into smaller particles that are passed out. But when they are very big, above 1 centimeter, which is 10 millimeters, those ones cannot be removed by just these common things. They usually need to be operated upon. So kidney stones, that's the long and short story of kidney stones.
Wow. I was about to ask now, what is the best? Should we maybe say kidney stones are better than chronic kidney disease? But looks like...
Kidney stones can cause chronic kidney disease, by the way, because kidney stones can block where urine should pass, and they can actually now cause the back pressure. I didn't describe the kidneys very well, but the kidneys are two bean-shaped organs at the level of your elbow, behind, protected by your ribs behind, and in front by your abdominal organs. So they are like the size of your fist. So they work. Then they have two tubes. Those two tubes are called ureters. Those ureters go on each side of your urinary bladder, the bladder that stores urine. Then after that, you have the urethra where the urine passes. So along all that path, the kidney stones can form along all that path. And once the kidney stones form, because the tube is very narrow, they can block it. Once they block it, you can get pain, you can get blood in urine, you can get infection. But worse, they can block, and the urine flows up and gives you chronic kidney disease. So also kidney stones can give you chronic kidney disease.
Wow, interesting. So actually all the problem is almost equivalent. And this is Awareness Month for Kidney Disease worldwide. Can you take us through maybe what should we know about kidney disease in such Awareness Month?
Yeah, so the month of March is Women's Month. Of course, we are waiting for tomorrow, the 8th of August. But along that same time, usually the second week of the month, we also celebrate the World Kidney Day. Usually around the 11th to the 13th, we celebrate the World Kidney Day. This is recognized. Of course, we are very excited as kidney experts across the world, because disease got recognized as a major disease that affects people by the World Health Organization and the United Nations. When they were talking about non-communicable diseases, diseases that are not caused by infections and diseases that are not transmitted from one person to another, they were only talking about the other major diseases like diabetes, hypertension, airway disease, which is chronic respiratory disease. They were talking about cancer, and over the last 5 years, mental health. Kidney disease was not considered among those, but over the
Was
last
not
1 year,
serious, maybe.
no, it has always been serious, but it's difficult to diagnose. Because blood pressure, you just put a cuff and you measure it.
Even the
Blood sugar, you
just
just take a tip. Cancer is so wide and varied because there are many different forms of cancer. Mental health is very common. Airway, when you can't breathe, it's very obvious for people to know, but the kidneys are hidden inside. And so it's very difficult to know. In fact, 90% of people with kidney disease don't know that they have it. Okay? 90%. That means every 10 people with kidney disease, only one knows. Because they don't examine themselves routinely. That's why it's very dangerous.
Because the examination is
The
expensive.
examination is expensive, but but examination, you can say it's expensive, but I'll tell you, on the other hand, treating kidney disease, as we are going to hear, is damn expensive. Very expensive. You need 4.8 million every month if you're on dialysis. You need 150 million to do a kidney transplant, and the test would cost you at most 50,000, just the screening test, or even less. So if you calculate and you see, because if you catch kidney disease early, you can reverse it. So the cost effectiveness of screening for kidney disease, if you have the risks, is much more cheaper than waiting to fall sick for kidney disease. But maybe you are right that it's harder to screen, unlike other simpler diseases, but that's no excuse. We know that 1 in 10 people have chronic kidney disease, adults. And diabetes, which is most feared, is actually, at least in Uganda, is only 3%. You know that. So that means that kidney disease is
more dangerous.
3 times more common than diabetes. Okay? And about half times that of hypertension. But hypertension, diabetes, cancer, and all the other diseases end up causing chronic kidney disease.
Wow. That means kidney disease must be given the attention that it deserves, because it is a silent killer, looks like.
Yeah, it is a silent killer.
And it is hidden. The diagnostic criteria is not obvious. It has to be a professional, and the signs are not really...
They are not common. Maybe we will talk about them. So, of course, you had asked me what causes kidney disease.
Yes.
So, the commonest causes of kidney disease worldwide, it depends on your age, by the way. Some people get surprised when they see children falling sick of kidney disease. They say, this young kid, how come they have kidney disease? Ono mwana omuto, dala doctor chikakasa naye yalwadde ensigo. Of course, the children can also get kidney disease, and this usually follows infections. So they can get malaria. In fact, there is a group, Dr. Batte and Professor Conroy have done a lot of work on kidney disease in the children who have sickle cell disease. They are very prone to developing kidney disease while they are young. Those who get severe malaria, pneumonia, diarrhea and vomiting, you name it, they are at increased risk of developing kidney disease. But also when children are born, sometimes they have an abnormality in their urinary system, the system I described that passes urine. If the tube does not form very well, if the kidney does not go to the right place, or if the bladder valve is not working very well, those children can actually get chronic kidney disease, especially if the urinary tract infections are not recognized early. There are also some other syndromes. There are also cancers of kidneys when they are young. But the majority of kidney disease in the children in Uganda is largely from infections. So that is there. Then when you come to adults, worldwide the commonest causes of kidney disease are diabetes, which is high blood sugar, high blood pressure, which is hypertension. Then we have others like obesity. Of course, you are an advocate for a nutritionist who advocates for exercise. So high blood, obesity, people who have large body mass. I'm also gaining weight. I gained 2 kilos. Trying to put them off. It's not easy, by
but
the
you
way.
are not.
No, I don't look big. People say I look good, but I used to be 70 kilos. Now I'm 72. I've tried to put them off.
Now it's a problem.
It's not a problem, but I know if I don't control it, I might end up becoming obese, and obesity. If your body mass index, of course, your nutritionist should know, is more than 25.
When it is 26,
Okay?
overweight begins.
Yeah, overweight begins. Then you go to obesity.
30,
then
33,
like that. Yeah.
grade 2.
Then you can even be morbidly obese. Morbid means you are close to dying. If your BMI is greater than 40, we say morbidly obese.
So
that can actually cause kidney disease too. The other cause of kidney disease is use of over-the-counter medications, especially the painkillers. People pop up ibuprofen, diclofenac, all those drugs. They can very easily lead to kidney disease. Then we also have repeated infections, especially in adults. So in the adults, when they get malaria, when they get diseases like HIV, when they get other diseases like of the joints, like rheumatoid arthritis, those diseases can actually lead to getting chronic kidney disease. You talked about the stones. I won't repeat that. Once you get kidney stones, depending on your diet, those can also lead to chronic kidney disease. We also have what is called autoimmune diseases, where your body fights. The body fights itself. In fact, I'm going to talk a little about this. I lost a nephew. 23 years old, in Chiruddu. The doctors did all they could, but he was diagnosed late. My brother's son, and he died of autoimmune disease, a disease called SLE. And actually, it was very devastating because I went there, talked to the doctors, he looked okay. We are supposed to probably put him on dialysis. He never made it, and he died. And boys rarely get autoimmune disease, but this was a young boy playing what? But of course, some people in the village delayed. Some thought he was bewitched. Even when we went for burial, still people, even when I told them, they still believe the boy was bewitched. So those autoimmune diseases come commoner in women. There's another lady I'm actually managing. She almost died because of lupus nephritis, but thank God we are able to treat her very well. She came when her kidney was working at 3%. What? 3 out of 100. Luckily, the family was okay. We are able to dialyze. I actually treated, she asked for permission. I talked about her on LinkedIn sometime, and we were able to save her. So you can get those autoimmune diseases. So if you see you are having a rash, if your body is swelling, you are not passing urine well, or you are passing blood in urine, those things can actually cause kidney disease. Then we have other infections. We are trying to eliminate them now, parasites, like schistosomiasis. Today actually I was treating a lady. She presented with blood in urine, and we looked for everything. They did scope. We sent her to Dr. Frank Asimwe, professor. He saw something in the bladder, didn't take it seriously, treated her. She continued to have blood. I'm actually going to do an X on it. She allowed me. And then she kept getting blood, and sometimes the urine would become normal. So we did a test, and we actually found that she had schistosomiasis.
Wow.
So we have started her on treatment. Hopefully she will get better, but it was very puzzling. It was so these worms can also cause.
They can enter the system.
They go through the blood. Of course, they come from water, especially if you are near. People will say, when I say schistosomiasis, people will get confused. It's bilharzia.
Yes.
From the snails.
Yes.
The Saccharia come, those small organisms, they bite you, then the things go, they grow in your body, they complete the cycle, and end up either going to the liver, if it is Mansoni, schistosoma Mansoni, or they end up going to the urinary bladder. If it is hematobium, sometimes there is another one called japonicum. It goes to your back and can actually cause you to get paralysis. But for us, we mainly deal with hematobium, which actually goes to the urine. Which examine the urine does not have any eggs. But yes, these worms can also cause kidney disease. So there are many other things. Any disease can actually lead to kidney disease. We can talk about pregnant women when they get preeclampsia, which is high blood pressure and the loss of protein in urine. The women can also get kidney disease. Sometimes kidney disease comes acutely after people have had an accident. When you get an accident, you lose a lot of blood. If the doctors don't treat you well, you begin with acute kidney disease. But if they don't manage you well, you can go to chronic. So all these things, abortions. If you do an abortion or get an ectopic pregnancy. An ectopic pregnancy is a pregnancy that does not occur in the uterus, but it occurs either somewhere along the fallopian tube. So that one in the wrong place, not the uterus. So if it grows there, it can cause bleeding, and that bleeding can still also cause you kidney disease. I'm moving from place to place, but yes, many things can cause kidney disease. Yes. Cancers, and for men, if you get a big prostate, the big prostate can obstruct that system, and you get a backflow, and you get kidney disease. Cancer of the prostate.
What brings a big prostate?
A big prostate comes from, it is the problem of men. We haven't found out what really causes it, but men grow big prostates. Of course, cancer sometimes is caused by smoking, taking alcohol, not doing enough exercise, eating fatty foods, and those things that cause non-communicable diseases. They can increase the risk of cancer. But for the prostate, we don't yet have a very good risk. You just have to go and screen yourself. If your prostate is big, they treat it so that it becomes smaller and doesn't obstruct. That takes you to the cancer also. Or for men, these men who used to be heroes, these days, you get an STD or an STI. That STI, now what it is healing, it causes you a stricture called a urethral stricture.
Yes.
Then the urine doesn't flow, it goes back up.
Or
for you, you say you were, or it dribbles. Then you say you were a hero. You can also get kidney disease from there. For ladies, cancer of the cervix can actually also cause kidney disease. People who are undergoing chemotherapy, those who have cancer, radiotherapy, those ones can also be at risk of getting kidney disease. So I've told you over 20 causes of kidney disease. So in brief, everyone can be at risk of kidney disease, especially if you also have a family member who has ever had kidney disease. But particularly if you have high blood pressure, if you have diabetes, if you have HIV, if you have sickle cell disease, if you are taking chronic medications for more than a month, then your risk of getting kidney disease goes up by about 5 times. If you don't drink enough water, you hold on to the urine, your risk of getting kidney disease also goes up. But whenever you fall sick and go to a hospital, your risk of getting kidney disease increases also.
Wow, wow. Thank you so much, Professor Kalyesubula. And of course, just before we go for a short quick break, I've learned that actually men who were heroes actually are such risk of getting kidney disease.
Not heroes like the soldiers, not heroes in bed as they call themselves.
Yes, it's actually was driving to the generation Z understands such language. Oh. And of course, we want to thank you so much. You've fully diversified all the points from all the corners, from the east, the south. And of course, the last point is critical. The more times you go to the hospital, it is also a risk factor to developing kidney disease. We go for a short quick break. When we return, more to discuss.
Gugudde TV, transforming your life.
Okoye okwegoba n'abakozi ba keeki. Kati nno Cake World tukola keeki z'emikolo gyonna. Omuli wedding cakes, introduction cakes, wamu ne birthday cakes mu flavour ez'enjawulo nga coconut cake, lemon cake, orange mint, vanilla n'ebika ebirala bingi. Tusomesa mwenna abaagala okuyiga okwekolera keeki. Omuli abawala n'abalenzi. Tusangibwe Matugga mu Kito ng'oyise ku ofiisi ya chairman. Tukubire oba WhatsApp ku 0748 57 31 6 ne 0706 82 12 96. Cake World for quality cakes.
Gugudde TV, transforming your life.
Thank you for loving Gugudde Television and for being with us, and of course on this very important show, Health and Beauty program. Every Wednesday at 9 p.m. you expect to see Kamara Dani on your screens, and of course bringing to you different health topics that actually insinuate you to prevent yourself, but also ready you to go for screening. And we do not say any drug here for you to go and buy, because remember, you must be screened, examined, and be seen by a physician for you to seek to get any treatment from any pharmacy. That's why I don't recommend any drugs here. For those who call in and send messages, please do not, rather seek physical support from a physician. And of course, I'm still with Professor Robert Kalyesubula, a consultant, a senior. I don't know if I say professor, I should again say consultant.
They are different.
They are different. I am really sorry. I don't know.
No, that's okay. I mean, they are different. I have both of them.
So I'm on the right lane.
You are on the right lane, no problem.
That's good. That's the reason I'm fasting for. God corrects me even when I'm going wrong, when I'm thinking I'm going wrong. Now, I want to explore a few signs and symptoms that could actually manifest if you are lucky, or the ones that you should not wait for, so that maybe you may be having chronic kidney disease or kidney failure at any point of your lifetime.
Yes, thank you very much. So, as I said previously, majority of people with kidney disease have no symptoms. 90% of people with kidney disease don't know that they have kidney disease. That's one thing. And then 70% actually have no symptom at all. That means the great majority of people with kidney disease have no single symptom. But as the kidney disease advances, kidney disease is like the way you send your child to school to study. When you send that child to school, you want them to score a 90 and above out of a subject. So if the kidney works 90 to 100%, if you are using the glomerular filtration rate, then it is good. But if it works less than 90% to 60, then it is mildly sick. If it works less than 30, moderately sick. And then if it works less than 15, you have what is called kidney failure.
Less than 15?
Less than 15% of kidney function.
How do we measure this?
Failure. You use the blood test I told you called creatinine, then you use the person's age, you also use their sex, and you put it in the computer, and it computes for you that value. We used to calculate it using a difficult formula called Cockcroft Gold. But these days, science and technology has made things easier. We just put your figures in our phone or laptop, and we get that figure. Some labs even just calculate and give it to you. So these people present, those who are unfortunate to get the kidneys worse, they usually present with reduced urine output. Remember I told you that a person is normally supposed to put out 1 to 2 liters a day of urine. If you produce less than 500 liters of urine per day, you might have a problem. Either you are not drinking enough or your kidney is not working, so reduced urine output. Once you get reduced urine output, that urine which would have come out goes somewhere, and it goes in your body. And so the commonest presentation of kidney disease for those who get it would be body swelling. And depending on what is causing the kidney problem, you can have swelling of the face in the morning, which is called facial puffiness, and you can also have swelling of the body, particularly the legs, because they are dependent. Then sometimes when you pass urine, that urine has foam. That foam, when you pass urine and you see foam coming, that is usually representation of protein. It might mean that you also have a kidney problem. Sometimes the kidney also presents with pain, especially lower abdominal pain. When you have lower abdominal pain, you might be having a kidney disease, or even back pain.
Sided or one side?
It can be one side, it can be both. If it is a stone, it's usually on the side where it is, but if it's a urinary tract infection or a pyelonephritis, it can go to actually both the kidneys. Then those who have frequent urination, unless they are diabetic, when they get a urinary tract infection, that can also be a sign of kidney disease. Now, those are the genuine ones before the kidney goes into real trouble. Once the kidney becomes very sick, today I've actually just admitted a gentleman again with a kidney function of 3%. I've sent him for dialysis. He has had obstruction of his bladder and he hasn't been passing urine, so he got into kidney failure. He feared to get a catheter, so the kidney now has fallen sick. So for those people, they come with body swelling, especially of the legs. They come with difficulty in breathing because they have retained the water and the water is now going into their lungs, it's going into their stomach. They also come with lack of appetite. Whatever they put in, they can actually vomit. They get dizziness because the kidney is important in making blood. So they are anemic and they present with dizziness. Some of them actually get these toxins going to their head called uremic encephalopathy. So they are nibutabika, being treated for madness, yet they have what? Kidney failure, kidney disease. Some come with that, nausea, vomiting, you can't keep anything down. Anyway, lack of sleep, also called insomnia, all can be symptoms of kidney disease. But don't wait for those. Those are advanced symptoms of kidney disease. So yes, people can get those symptoms, but again, I emphasize that kidney disease is often asymptomatic.
Wow, thank you so much, Professor. And before we go to prevention, we just want to talk about, now, if a person gets one of the symptoms, what do they do? Let's talk about social media. We've been having very many people who have made concoctions for kidney disease treatment. For many people, you know, the juices, the detoxes, the drugs, and they send you liters, 5 liters, 3 liters. They tell you drink 2 glasses a day, all those. What's the message? If a person finds the symptoms or feels the problem, should they start the treatment from the village and they come to you later?
That's a difficult question. So, those remedies most people use, I don't know whether they work or not, but probably they do work for people who have no kidney disease. You understand? For prevention. So if someone tells you drink a lot of water, or you put something in the water and you take it, that's okay maybe. If someone tells you maybe take herbal tea when the kidney is not sick, that's also okay. But once the kidney falls sick, once the kidney is sick and you are diagnosed with kidney disease, you have to be very, very careful. Because for us, when people come to us, we even tell them not to eat the usual foods. You know this. We tell you don't eat bananas because they contain a lot of potassium. Avoid Irish potatoes. Do this to the matoke. Avoid passion fruits. Avoid the jackfruit. These are natural things. If those natural things can damage the kidney, now what about the herbs, the kadomola? So if someone has kidney disease, they had better seek real medical help. But if they are preventing, maybe those ones can try. But if you have kidney problem, you really have to go to an expert and they treat you. And this is the problem. And I say this. People who treat diabetes with herbs. So sometimes people take those jerrycans and they say, oh, we have cured the diabetes.
They send them to you from Bale.
Yeah,
to Kampala.
and they say they have cured the diabetes, and truly they cure the diabetes maybe, but it's not curing. What happens is that if you take those herbs too much, what they do, they knock down your liver. Then they knock down your kidney. Now, the kidney and the liver, they are the organs that work with the pancreas to control the sugar. Now, if the pancreas, you are not type 1 diabetic and you are type 2, the pancreas is, of course, producing some insulin. But after that insulin has done its work, the body needs to remove it. And it's the liver and the kidney that is responsible for removing the insulin. So now, if they are sick, they will not remove that insulin. So the insulin will control the sugar. And now they will say, you go to your doctor, test. And the doctor tests, and indeed, the sugar is better. But guess what? Those herbs have destroyed your what?
The kidneys
the kidney and the liver. Then you end up coming to us. You say, I was doing well, I've never done what? And we put you on dialysis. Damn expensive. So those herbs, you have to be very careful. And you see the problem with social media. For us, as doctors, we have what is called evidence-based medicine. Even there are some herbs that work, it is true, but those are studied. I happen to have had an opportunity to visit India. I went to India to a very good center, and in that center, they use herbal medicines. And you know what they've done with herbal medicine? They've studied them. They ask you, where do you want to go? Do you want to see Western medicine, or you want to see the herbal medicine expert? Those guys have PhDs, and they don't give you budomola, jerrycans. They have tablets, they have syrups, and they measure them. They give you a prescription. You go and pick. But here in Uganda, my grandfather used the herb. You walk 5 kilometers, then you turn right, then you pick the flower, then you come back. Psych! And then you end up taking a kadomola sincerely. And then, of course, it knocks down your kidney. So those herbs, luckily, we now have the government as asked the I forget the name of the ministry.
NDA.
No, not NDA. NDA regulates, but there is a full ministry headed by Dr. Nambatia, Dr. Bruce Chirenga, Professor Byachika. They are now doing studies. You saw like a professor who invented the
COVID-19.
COVID-X. At least those were studied medicine. Dr. Rutoti. They go and they study these medicines. Erokov. And they get approved through the process. Those are remedies, but they have been studied. And we prescribe them, and we know the dose. We know they are going to interact with the other drugs we give. Okay? But these things of jerrycan, you have one mumbwa, karakasa mumbwa, it heals 10 diseases. Come on. Ikigalanga, olubuto, ensigo, prostate.
Ate obulango bungi ku radio.
Yeah, bulango buba bungi. Those things, especially when you talk about male dysfunction. Oh, kasteberanga egiranga omulondo. Then people rush. Okay? So, of course, all those things do knock down the kidneys. They knock down the liver. So, I'm not a very good advocate of herbal medicine, especially that one which has not been well studied and approved by some level of safety. So, that's and of course, everyone can say anything. Today, you are young, you don't know Nanyonga. Nanyonga came here when there was HIV, and she said soil heals HIV. And people flocked there, and they were buying soil and eating it. I tell you, even if I put FISN somewhere and went on radio, me being Kalyesubula, and said it heals, people will take it. You have to think. And anyone can say anything on media. That's the problem of that. It's not regulated. So, of course, you have to think before you do things.
Because, yes, a lot is happening on social media. I saw one advertising some tea and gave it 10 diseases. This is a 10 what? You often say 5 what? There's a 5 thing you often say, 5, big 5. Yeah. Now, this person was talking, this is 10 disease healer, 10 disease cure.
Okay.
Yes, and mentioned the diseases. I was like, wow,
Yeah.
wow, social media is powerful.
So
And that person can get more patients than you.
yeah, so once you see, me, I have enough patients, by the way. I'm overwhelmed. I almost didn't come to the show, because the patients are many. We are still very few nephrologists, but you don't need a nephrologist to treat you if your kidney is still in early stages. A physician, a medical officer, a clinical officer, they can all treat kidney disease when it's in the early stages. For us, we come in when it's complicated, and we should talk more. This is why we are here, so that people don't even need to come to us.
Exactly. Because getting is also very hard. Now,
Yeah.
doctor, let's drive into the prevention strategies that we can start from a house, from an individual household, then the general public.
So I think as an individual, you have to know that your health is your responsibility. Yeah, like Professor Maswa said one time, our Director General, okay, health is made at home and only repaired in hospitals when it gets broken. So the primary custodian of health is yourself. So you have to look at what you eat. You have to look at your lifestyle. I didn't talk about smoking. I didn't talk about alcohol. Those are leading causes of kidney disease. But largely what we eat. If you eat a lot of fatty foods, all the time you are eating fats, you are taking a lot of salt. Salt is a very major cause of high blood pressure, and it is a major cause of kidney disease also. Especially if you put in a lot of salt. Those things you can control at home. If you eat food and you don't include fruits, okay, and vegetables, those vegetables and fruits have minerals, but they also have antioxidants that help to remove the toxins from your body. Maybe that's what the herbalist should use. So those ones help to keep you healthy and you don't get sick in the first place. But there are other things that you also have to do. If you have things like diabetes, hypertension, cancer, HIV, you're on chronic medication, you have sickle cell disease, then you have to take the responsibility of having yourself tested. Have a urine done, have a blood test taken at least once every year, especially if you're above 40 years of age. Then after that you will know, and then you begin to look after yourself. Sometimes foods you don't eat, you do regular exercise and all those nice things. Have enough sleep. You need 6 to 8 hours every day of sleep to make sure that your brain relaxes. But as the brain relaxes, even the other organs relax, including the kidney. Don't hold on to urine for long periods of time, because urine can flow back up and actually begin damaging your kidneys. If you get passing urine more than 3 times a day, which is called frequency, also go and get yourself tested. You might have a urinary tract infection. If you're a pregnant lady and you know you are pregnant, go and attend antenatal, because in antenatal the doctors know how to screen your kidneys. They do a urinalysis, and once they see protein, they can help you. Now that's coming to the healthcare system. But by and large, it is largely what we eat, what we drink, the way we do our exercises that prevents kidney disease.
Wow, thank you so much. I love the way you said pregnant women, adults. How about young people?
So for young people, if a child is born, when a child is born, they have to examine them. They have to examine them to see whether they have the test, whether their penis opens and passes urine. Some are born with phimosis. And again, you have to watch that the child is urinating well. Is he wetting, what do you call that? The nappy?
Pampers.
Pampers. If they are not wetting the pampers, you might be in trouble. Sometimes the technology has even gone so far. These days, if you go for a good ultrasound scan, they'll tell you whether your child has 2 kidneys and whether they have an abnormality in utero. So that can only happen when you attend antenatal, and when they are born, the doctors can help. But if a child also has malaria, or they are passing tea-colored urine, if they have any blood in urine, then you have to actually suspect that they might actually have kidney disease presenting with low abdominal pain. The kids might also have kidney disease. So you always ask your doctor. Children who get excessive diarrhea and vomiting. So once a child gets that, ask the doctor, is my child's kidneys okay? Because you can't know unless you check. So those usually present. And some kids also get kidney stones, unfortunately. So you have to be careful as well. So you make sure they drink enough water, they take tea. Yes.
Wow, perfect. Perfect information. We are learning from an expert, so we don't want to leave any stone unturned. Now, let's dive into a few major complications that are seen, then later we conclude that very program.
Thank you. So the kidney can actually affect any part of the body. I told you about people ending in Butabika. The kidney is one of the commonest causes of heart disease, equivalent to smoking. The kidney is very important. The kidney is a big problem in causing lung problems because it can make you retain urine. The kidney can go to your brain and cause a stroke, cause high blood pressure. The kidney can also cause you to have no blood, also called anemia. And then you move around with dizziness, so the kidney can do that. So the kidney has very many complications. It can actually affect virtually every organ of the body. You just have to make sure that you get it diagnosed early and it gets treated. So the treatment of kidney disease is sometimes nothing. If you are in the higher stages, we just tell you to take a lot of water because that helps the kidney. We tell you the diets to take. But once the kidney becomes more sick, sometimes give you some medicines which you take. And now we are at a very good time because we have newer drugs that can treat, reverse, or even cure kidney disease if it is diagnosed early. Unfortunately, if you don't, then you need life-saving treatments which are called dialysis. Hemodialysis is a process where we get your blood, take it to a machine, clean it to remove the toxins, and then we give it back to you through that process. It usually takes about 4 hours. You need to put in a catheter so that you gain access to the big blood vessels. The damn problem is that it is expensive. It costs anywhere between 150 and 400,000 per session, and you need 3 sessions per week, and that excludes all the other medicines you get. So, and once usually you start, if it is chronic kidney disease, you can't get off that dialysis. But if it's acute, yes, many people have gotten off that dialysis. And then if you fail to do that, you might need a kidney transplant, where you need someone who is examined and is doing very well, probably a relative, and they donate one of their kidneys to you. That is quite expensive. We fortunately are now able to do kidney transplants in Uganda. We have done 15 transplants so far. We thank Dr. Bagasha and Dr. Asimwe Frank, along with the leadership of Mulago and the Ministry of Health, along with all the other team members who have played a very big role to ensure that our transplant program goes on well. At the time, the government is still paying for those transplants, but we are very selective. So the majority of people don't meet the criteria for transplanting in Uganda, and they have to be referred to other countries where it costs between 120 and 150 million shillings to get a kidney transplant. And that is not buying it. We don't buy kidneys or sell them. That is the process. So there is no money to buy kidneys. You might say, oh, you buy a kidney, 10 million. No, we don't buy or sell kidneys. If you are caught selling a kidney, you are liable to being imprisoned for about 5 years, okay, or more, or you pay fine. If a doctor is caught doing these things, for him is fined for 10 years, or he pays 1 billion shillings. And this is not speculation. It is in the Ugandan law. So every day I get someone calling me that they are selling their kidneys.
We are broke. Twagala sente.
Mwagala sente na you sell your kidney, then you can die. And you don't just sell your kidney anyway.
Wow. Wow, thank you. Twagala gigs. Wafona gig bwejo banange Professor tubulire. Nenga, we want to thank you, Professor. As we intend to conclude, just give us your way forward in 3 folds, and then we conclude this very important program.
So thank you very much, Mr. Kamal. Number 1 is that your kidney health is in your hands. We are celebrating the World Kidney Day. We are going to be in Hoima from the 12th and the 13th. We are going to do a conference. We are also going to inaugurate the dialysis unit there. So I should say that. But your kidney health is in your hands. What you eat, what you drink, how you sleep, how you exercise, and how you check yourself. the amount of water you take in the day, the amount of salt you take in the day, those are all responsible for your kidney health. If you are 40 years and above, at least make sure that once every year you get your kidneys checked to make sure that they are doing okay.
Wow, thank you so much, Professor. I want to thank you for visiting us today and, of course, sharing your expert information to our dear viewers. I want to thank you. Since you started with us up to now, please follow our social media platforms, Gugudde Television Uganda on X, LinkedIn, Facebook, TikTok, so that you can learn more about this kidney disease. The responsibility still lies in your hands, not in government's hands and not in professors' hands, rather in your hands. Hope to see you next week. Stay safe. Bye-bye.
Hi, this is